right, so we are in Austin, Texas, checking out one of my friend's new office. He just started his own practice. He's a plastic surgeon. It's called Pearce Plastic Surgery. We're here in Austin, and we're going to talk to him about life after training. And he was a general surgeon before, and then went to do some training in plastic surgery. Like, what does it look like after you do all your training? You know, this path is very long. You go through a number of years, and then this is where you end up at. So you guys are going to come in and check it out, and then we're going to meet Dr. Pearce. So come on in.
Hi, I'm Dr. Paul Pearce. Welcome to Pearce Plastic Surgery. So this is our waiting room. This has kind of been a process that's been building. This is my private practice, solo practitioner here in Austin, Texas. Trained with Antonio Webb in San Antonio, but after training I decided to go out on my own and open up my own practice here in Austin. So, opening your own practice is kind of a daunting task, but it's a process that I've been kind of learning for the past 8 months or so.
All right, cool. So this is your front desk when patients check in.
Yes. So this is the whole waiting area, and then the front desk area. We have a front desk coordinator, and then our patient care coordinator who also works with patients as well.
All right, cool. Show us around the office.
So let's see. I guess we can start off with the boring stuff. When you have your own private practice, you have to have all your supplies, and you kind of figure out what you need as you go. You go for anywhere from cleaning supplies to sterilization products to gauze and bandages for all your patients, things that you don't really think about in residency. And then we have here, this is our media room. This is where we're going to get started producing a bunch of content for our YouTube channel, The Plastic Life. So we only have a few videos up there right now, but we're working on a whole streamline of things for residents, for medical students, people who are thinking about opening their own private practice, pitfalls and things like that to watch out for, especially things that I've learned over the past few months. So I'm hoping to start producing that, because when I came out and started this, there really wasn't much material on how to start a private practice, so I kind of had to learn a lot of this on the fly and kind of relying on other solo practitioners and things that they did. This exam room right here, we usually see all of our plastic surgery patients and things like that in here. This is kind of more set up for seeing our patients who need breast augmentations, abdominoplasties, any cosmetic work, really.
And what type of patients do you normally see in your clinic? Is it more of a cosmetic, or is it just whatever comes in the door, or what kind of patients do you normally see?
It's essentially whatever comes in the door. I mean, we do take insurance, so we are seeing reconstructive patients as well as the cosmetic side as well. So it keeps it a nice balance. It keeps the challenges kind of on the different realms of plastic surgery, because you have your full-on cosmetic side of plastic surgery, but then you also have your reconstructive, and they both have unique challenges. So that's why I enjoy seeing both sides of that. This is one of our other rooms here. We also, I started the Texas Hair Restoration Center here in Austin, and in this room, we see patients, but the chair's pulled out here this way because when we do our hair restoration procedures, a lot of the hairs need to be implanted into the scalp. We want our patients to be comfortable. So our patients sit here, and then me and a technician work back behind the scalp, implanting all the grafts into the scalp. So, it can take a little while to do, but it's a gratifying experience, because about 9 to 12 months later, patients get to see the full outcome of the procedure that we do here for them. Right here, this is more of the area that we use to prep our patients for the hair restoration procedure that we do. We have the Artis IX robotic hair restoration system here. We're the only practice here in Austin, Texas that has the robot. So it's a unique thing to our practice, and it's something that we're kind of getting the word out about. More and more patients are coming to see us for that. But this is where people will sit. We talk about hairline design. We draw on the hairline and make sure that they're happy with it, we're happy with it. And then after that, for the Artis robotic system, you tend to need to have your head shaved. So the hair gets all clipped in here, patients get prepped, numbed, and then we come over here to this room.
So you actually have an actual robot in your office.
This is this is our robot. So this is the Artist IX. This is the brand new top of the line robot from Restoration Robotics. This company has been around since 2011. And they have a few iterations of this robot, but this is their newest, latest, and greatest. It is a robot that has 3 cameras, and because of the 3 cameras, we can see each follicle on the back of the scalp from the safe donor area, which is kind of in the back here. And then, look at that guy.
Got me up on the screen there.
Yeah. So it identifies the follicles from back there, and then with a punch, it can take out each follicle, and then from there we can lift it out, prepared underneath the microscopes here, and then we go ahead and implant it into the hair areas that need some help. So the nice thing about this robot is that it can harvest the grafts, but then it can also do the site making, or it can also do the implantation itself. We can load the grafts into what look like cartridges, and then it can actually implant the grafts into the scalp. So the cameras and the computer system it has helps identify the hairs that you already have. It can help avoid those. You don't damage those. So you get to keep the hair that you still have, but then fill in the areas where you're lacking it. Part of, it's one of the things that when you do your own procedures in your office, you don't really get too much exposure to in residency is keeping all your instruments clean and keeping your Botox and everything like that refrigerated, what temperature they need to be at. So this is our autoclave. This is what sterilizes all of our equipment. This is our ultrasonic cleaner. We tend to put all of our instruments in there after we've done some manual cleaning on them, and then run them through the ultrasonic cleaner. This right here is our centrifuge, which we use for PRP, plasma-rich protein injections. So we'll run the blood through there, separate it out into the layers, and we draw off the plasma-rich protein towards the bottom.
Can you explain to the viewers what PRP is, if they may not know what that is?
Plasma-rich protein is a part of, it's a treatment that can be used for various number of things. A lot of times people have seen it being used for facials, microneedling, where it has some regenerative properties. And then also we use it for hair restoration as well, because as we spin it down, it has growth factors in there. So when we inject it into the areas that are thinning out in hair, it can actually help reactivate some of those hairs. So people tend to see a pretty good effect from that. Some people need probably 2 or 3 treatments over a 3-month course, and then they'll see some progress from that, usually around the 3 to 6 month mark. Usually after the first treatment, they'll see that the hair is kind of slowing down on falling out, and then after the second and third treatment, they start to see some progress in those areas that they've been lacking hair.
Gotcha.
Yeah. So, and I guess the last piece, which isn't really quite done, is my office here. So my interior designer is still kind of working on some things, and that's why I don't have anything up on the wall. I got my diploma down there from plastic surgery, so we're still kind of waiting on a couple things to get here. Overall, that's the office. That's the practice.
All right, Dr. Pearce, good to see you again, man.
Good to see you. Thanks
congrats.
for coming.
Yeah, thank you.
Thank you.
And congrats on finishing all your training and opening up your own practice.
Yeah, thank you.
Can you tell the viewers who you are and where you went to did your training and where you're from?
So I'm Dr. Paul Pearce. I grew up here in Texas, went to college here in Austin, Texas. Went to medical school at St. George's University, School of Medicine down in Grenada. Mm-hmm. So I went to school in the Caribbean. And then after that did my general surgery training for 6 years in Long Branch, New Jersey, so at Monmouth Medical Center. And from there trained at Newark Beth Israel in downtown Newark, New Jersey, and also in New York City at Memorial Sloan Kettering Cancer Center. And then from there, got into plastic surgery training at UT Health down in San Antonio, where I met you.
Gotcha.
Yeah.
Yeah, so it's been, 6 months since you graduated?
Yeah, about, March now, so, this is about 9 months now.
9 months, okay, gotcha. How's life been since you left all your training?
It's been a transition, because I've spent about 9 years in surgical training. So 9 years of surgical training, you're used to getting up at 4 o'clock in the morning. Yeah. You're going to get through rounds. You're trying to get ready for the OR by 7:30, 7 o'clock. And then all of a sudden, when you graduate, when you're opening your own practice, you have your own schedule.
Yeah.
So it was a little bit of a transition period. I had to kind of figure out, how to manage that time a little differently versus being in residency where you have a strict schedule that you're trying to stick on and get through the day. Whereas, after I opened up my practice, it was, kind of getting things organized and figuring out what tasks need to be done so that we could get this finally open and ready to go.
Got you. So I know some people can't even imagine kind of doing all of this and, getting a building and, getting employees. I certainly can. I know it's a lot of work to do that, especially coming out of training when most people are trying to make money because you were what, PG 9 or 10 or something like that, something crazy. What has been the most challenging aspect after all your training?
The most challenging aspect of all this is really learning the business side of medicine, because that's not something that we really get exposed to in residency. You're going through the motions, and really you're learning the material, and you're trying to get ready for the exams, either the in-service exam or the board exam or something along those lines. So, the business aspect of that, whether, what it costs to run your business, what it costs to get it off the ground, how to write a business plan, those are all things that we just don't get exposure to. And it's something that I've had to learn over the past, year essentially, because I had to start even before I graduated because I knew that this is what I was going to do. So in order to do that, I had to learn how to write a business plan. I had to, figure out what the banks needed in order to approve that loan. So that the business side of medicine has probably been the biggest challenge, and it's something that I think we as residents need more exposure to, and more exposure to even as medical students, because that it's in the end it's you have to be able to pay your bills in order to take care of your patients.
Yeah, that's exactly true. I mean, this whole kind of medical path is the business aspect, and they just don't teach that in class, and I wish they did, because I think that it made this transition, I assume, a lot easier.
Yeah, it would have.
Compared to your residency and fellowship kind of day-to-day life, what does a day look like for you, kind of in private practice, have your own business? How does that look for you?
It's a lot more enjoyable compared to residency. Residency was go all the time, and you're just trying to take care of your patients and make sure that everybody's happy during the day. Nowadays, I wake up and I get to hang out with my daughter in the morning.
Nice.
We have breakfast together. I take her to daycare. I'm here by 9 o'clock in the morning. We start seeing patients. We do a few procedures here and there. And then, it's a lot more gratifying, because I think this is mine. This is for me. This is something that I've been working for a long time. So, in the end, it's more work actually than being in residency. But I think that at the end of the day, it's more gratifying.
Gotcha. What type of procedures or surgeries do you perform as a plastic surgeon? For the people who are trying to figure out whether they want to be a plastic surgeon or not, can you tell us about some of the surgeries you perform?
So plastic surgery, the side of plastic surgery that most people see is the cosmetic side, where they see Dr. 90210 or
Hollywood
or botched, those kind of things, right? So all the cosmetic stuff is part of that. But on the other side, though, you have the reconstructive aspect of it too. So you're helping patients all the way from breast reconstructive patients who have breast cancer and have had mastectomies. So they want to have the breast reconstructed, and there's multiple ways to do that. You have patients who get in car accidents, patients who are victims of assault. So it's a wide range of people that you're taking care of. You even have military veterans that get pressure sores that plastic surgeons go in and do flaps for those ulcers. So that's why I was drawn to plastic surgery, just because it's a wide breadth of a field that we end up dealing with. We end up taking care of everything from hair restoration to taking tendons from the foot to reconstruct tendons in the hand.
Wow.
So those kind of things. That's why I got into it.
Got you. You mentioned you have a family. You have 2 children and a wife.
I got one daughter and one on the way.
Got you. Congratulations.
Thank you. Yeah, and congratulations to you too.
Thanks. Appreciate it. Because people always think about the as a surgeon and trying to raise a family and start a practice, but you're living proof that it is possible. You take your daughter to daycare and you're able to spend time with her. So for the viewers out there who are in medical school or residency, as a private practice surgeon, you can make it as whatever you want. You can work 20 hours a week if you want to.
You certainly could. If you're going to be working 20 hours a week, though, you got to be pretty efficient with what you're doing.
But it is possible to have a life outside of medicine, even in private practice, even with the family.
Yeah, it certainly is, and even in residency, I was told, oh, you're going to go into surgery as a medical student. You're never going to have a life. You're never going to get to do anything fun. Yeah. But that wasn't the case. My training program was on the beach in New Jersey, so I got to go surfing. I went to the beach all the time. It's really what you make of it is make of your time with your free time that you have. So, now that I'm out of training, I get to dictate my time now, which is nice. I do get to spend time with my daughter. I go pick her up from daycare too.
Nice.
But that also means that, if there's still work to be done after she goes down to bed, I come back here and I keep working, or I work at home until, midnight, 1 o'clock in the morning sometimes.
Gotcha.
It's just whatever needs to be done.
Gotcha. You mentioned kind of the surfing thing. What other things do you like to do outside of medicine?
For me, I've always grown up on the water, so I've always loved either surfing. I was a professional wakeboarder for a while back in the late 90s, early 2000s. I rode on the tour there. I was a judge for the tour. I was a manager for a kiteboarding company, Liquid Force Kiteboards, out in San Diego, California. And then got into med school, but still, I get on my bike, I go mountain biking. There's a new downhill mountain biking place here in Austin, so we go over there. And then, so I tend to get out and get into the sports that kind of gets the adrenaline going.
Gotcha.
Probably shouldn't be doing that as much anymore, but I'm still doing it.
Yeah, gotcha. What's next for you? Next, I don't know, year or 5 years? What do you see yourself?
For the next year, it's really kind of building the practice. A lot of people said, it takes about 5 years to really get your practice established. So really the next year is all about getting our name out there, building our patient clientele, and making sure that we're known in the area. And that takes a lot of work because, the things that you have to do as a solo private practitioner is you have to go out and meet everybody in the field. You have to go out and meet everybody who, is going to be sending you referrals. So going out and meeting the OBGYNs, the dermatologists, the family practitioners, the weight loss surgeons. It's a lot of work and a lot of networking that needs to be done. And I just never seem to find enough time in the day. It's always seemed like, I need a 48-hour day to be able to get a lot of the stuff done.
Yeah, gotcha. I hear you. Yeah, it's to accomplish in that day. It's long also, but the time you have to do is really short. But advice for students out there that either pre-med, high school, college, they want to go into plastic surgery or just medicine in general, what type of advice would you give them?
I would tell anybody who's looking into getting into plastic surgery, going into med school, make sure that you're presenting the best of you forward, and do those things that that show people that you're interested. Once you get into medical school, you're trying to get into plastic surgery residency. There's two ways to go. You can either go straight into plastics, or you go like I did, general surgery, and then into plastic surgery. It's a longer route, but it all gets you to the same place at the end. I would say, tell people, hang out with the plastic surgery residents, spend some time with them, talk to the plastic surgery attendings, make sure you really know what you're getting into, make sure that you really want to get into the surgical field, because it's different than other medical fields. Gotcha. It's a little bit more intense at times, and it's very demanding too, but I would say, talk with people, get advice, because advice from people who've already been through it is worth its weight in gold. So just make sure that you really want to get into it.
Awesome. And for the people out there that maybe want to see you as a patient, or they're in the Austin area, how can they get a hold of you or your practice?
Yeah, they can go to our website, pearceplasticsurgery.com, or they can call us here. Our phone number, 512-764-9076. We have our staff here answering the phones, and then they can also get a hold of us through the website as well. So awesome. It's very easy to get in touch with us. Yeah,
and I'll put the links to his practice as well as the phone number and your websites in the description below. But congrats, man.
Yeah, thank you.
Thanks for all your inspiring people who want to go into medicine, and also for those people out there that want to open their own practice. It is possible. This is awesome.
Takes some work, but it's possible.
Yeah. Thanks again, man. I appreciate it.
Thank you.
No problem.